What about diabetes? Is diabetes another men's health indicator?
Absolutely. So diabetes is probably the number one cause of erectile dysfunction.
Okay.
We know that probably more than a third of Americans have diabetes at this point, and men who have diabetes, about half of them have erectile dysfunction. Within 10 years of a diabetes diagnosis, erectile dysfunction or ED is almost 100%, especially in men with poorly controlled diabetes. And the reason why diabetes has such an profound impact on erections is because it affects three or four of the ingredients to a good erection. It causes blood sugar causes little damage to the tiny blood vessels that feed blood into the penis. It causes damage to the nerves that send the message to the penis to get blood. If you have diabetes, you probably know that you could get neuropathy in your feet. And so
Hmm.
neuropathy happens to the penis as well. It causes scar tissue to form in the smooth muscle that needs to be very pliable in the penis to work well, and it can affect testosterone. So, very huge impact on male sexual function. And then from a fertility standpoint, it also has a big impact because nerves are really important for ejaculation. And, again, testosterone is really important for fertility. And that's kind of the male hormone that's important for making sperm. And diabetes has a huge impact on this field of men's health.
So you said that you can have neuropathy in the penis. Talk a little bit more about that. That's the first time I've heard that.
Yeah, for sure. So I think of the nerves to the penis, there's sort of two categories of nerves to the penis. There's the sensory nerves, and certainly guys who have neuropathy in their feet where they can't feel in their feet can get reduced sensation in the penis. But I think of it also as, the nerves that run along the side of the prostate, the cavernous nerves that guys who have prostate cancer treatment know all about because you know about nerve sparing and how, those nerves are really important for sending the neurotransmitters, the messages to the penis to stimulate blood flow to come in. And those nerves can be equally damaged. They're not sensation nerves, but they're more like functional nerves, and they can be damaged by high blood sugar, and that is hard to reverse. We know that men who have diabetes, for instance, have less effect of taking pills for ED, like Viagra, for
Hmm.
instance. Those don't work as well for those guys because those pills are really just boosting the message on those cavernous nerves. They're just sort of turning up the volume. But when those nerves are kind of damaged, or I think of them like telephone wires, if the
Hmm.
wires are fried or frayed, you can't, you could turn up the volume all day long, but you're not going to get that message through the system. And so that's why pills don't work as well for guys with diabetes.